Did you know that hernia repair can fail if patients ignore simple recovery rules? If you've just had a hernia operation, you might be feeling overwhelmed with flood of advice out there, especially about the need for bed rest. Hi, I'm Dr. Serralta, a hernia specialist in Dubai. Today, I reveal the critical do's and don'ts to ensure your surgery is a success. You are fresh out of surgery, full of questions about what comes next. Should I lie in bed? Can I hit the gym? These doubts are completely normal. In today's video, I'll share how early movements can work wonders for your recovery and why the traditional idea of prolonged bed rest is a myth. So, let's get started. Question 1. Debunking the bed rest myth. One of the most frequent concerns I hear is, do I need to be on complete bed rest after my hernia surgery? There is a common misconception that after any major operation, you must stay in bed and avoid movement altogether. In fact, complete bed rest can do more harm than good. Immediately after your surgery, our goal is to get you moving as soon as it's safe. Early mobilization is key because it helps improve your breathing, enhance blood circulation from your legs back to your heart, and significantly reduces the risk of a deep vein thrombosis, which is a blood clot that can be dangerous if it forms in your legs. Additionally, getting up and walking helps stimulate your intestinal function and boosts your appetite, which are crucial for your overall recovery. So, while you should avoid strenuous activities, I strongly advise you to get out of bed and start moving as early as possible. With adequate pain relief and careful guidance, early ambulation is one of the most effective strategies to shorten your recovery time and improve your overall well-being. Another common question is, can I go to the gym after my hernia surgery? Many of my patients, especially those who are active and regularly exercise, worry that a hernia repair means the end of their fitness routine. Let me reassure you, this is not the case. The timeline for returning to exercise largely depends on the type of surgery you've had. For patients undergoing a laparoscopic hernia repair, most can resume day-to-day activities as early as the third day after surgery. Simple activities like walking around the house and even climbing a few steps are safe by then. Within about 1 week, you should feel comfortable enough to drive short distances and enjoy light outdoor walking. However, when it comes to gym workouts, especially weight training, it's important to be patient. Typically, you should avoid heavy lifting for at least 6 weeks. By then, you might be able to resume weight training once your body has had sufficient time to heal and your core muscles have regained strength. For those who have had an open hernia repair, the recovery might take a bit longer, and your doctor will guide you accordingly on when to safely resume different forms of exercise. Question 3. Dietary recommendations. Now, let's talk about diet. A common concern among patients is whether you need to change your diet or avoid certain foods after hernia surgery. The truth is, since hernia repair primarily involves the abdominal wall and not the digestive tract, there are no specific foods that you should avoid. However, what I do recommend is focusing on a high-protein diet. Protein is essential for tissue repair and helps rebuild muscle strength, which is particularly important after any surgical procedure. Whether you are a meat eater or a vegetarian, ensure your protein intake is enough. If you are vegetarian, consider alternative protein sources or a protein supplement. In addition, it's important to maintain a balanced diet rich in fiber. Adequate fiber intake helps prevent constipation, a common post-surgery issue that can lead to straining and put unnecessary pressure on your healing tissues. So, while you're free to eat most foods, aim for meals that support healing. In proteins, whole grains, fresh vegetables, and fruits, these should be your choices. Question 4. One of the most pressing concerns we hear is, how do I prevent my hernia from coming back? This is absolutely valid, and preventing recurrence involves a few important lifestyle measures. For the first 4 to 6 weeks, I'll follow all postoperative instructions diligently. This means adhering to your dietary guidelines, avoiding heavy lifting, and ensuring you don't strain during bowel movements. High protein intake and adequate hydration are crucial during this period to support tissue healing. Lifestyle modifications. If you smoke, it's imperative to quit before surgery. Smoking not only impairs tissue healing by affecting blood flow but also compromises the quality of the fibrous tissue that forms during recovery. In addition, it causes this morning coughing, which is terrible during the first weeks of recovery. Similarly, avoid excessive alcohol and monitor your weight. Gaining extra pounds can strain your abdominal muscles and increase the risk of recurrence. Keep your follow-up appointments. Regular checkups allow us to monitor your progress and address any concerns early. In summary, the recovery process after hernia surgery is all about smart, gradual progress. You don't need to be confined to bed rest. Early movement is not only safe but beneficial. You can gradually return to your normal physical activities, including gym, workouts, following a clear time tailored to your specific surgery. Your diet should support healing by focusing on protein, fiber, and hydration, and adopting a few lifestyle changes. You can lower the risk of hernia recurrence. Thank you for spending this time with me. I hope this video has clarified your doubts and empowered you with the knowledge. If you have any further questions or need personalized advice, please do not hesitate to reach out. I'm Dr. Daniel Serralta, wishing you a smooth, speedy recovery. Thank you.